Good afternoon. We're sitting here with Dr. Zama, running for governor of Pennsylvania at the People's Church of Christ in Bucks County, Pennsylvania. What we're doing today is we're going to do a one-on-one with Dr. Zama. We're going to ask him a few questions. First thing we're going to ask Dr. Zama is a little bit about who he is, his background, and why should we vote for you?
Yes, I'm very glad to be here this evening. And yes, my name is Dr. Niche Zama. I'm a retired cardiothoracic surgeon, and I live in the Poconos. I'm running for governor of Pennsylvania. And a little bit about my background: I was actually born in Cameroon in a little grass hut village where I grew up and raised by two Christian parents. And when I was 3 years old, I started elementary school. And unfortunately, when I was 10 years old, my mother went to the hospital to give birth, and she bled to death after childbirth, and I was standing there holding her hand. And she died because there was not a doctor available to save her life. And so I decided I wanted to be a doctor. And a few years later, after I graduated at the top of my class in the secondary school, I was sitting in a hut when the natives donated what amounted to $20. And my father sold his hut and crops and gave me $300, and I used that to buy a one-way ticket to New York. So I arrived in America, this great land of opportunity, with $20, and I went on to work very hard, struggled, suffered, and graduated and got a bachelor's degree in chemistry and went on to do a PhD in chemistry as well, and a master's in management from Harvard. And ultimately I was trained and educated to be a heart surgeon at Harvard Medical School. After that, I went out and started to travel the world and doing humanitarian work, operating on babies in Asia, South America, and Africa, and being a mentor to many kids in our cities right here in the U.S., kids who were struggling academically or poor kids. And then I went on to build schools because I believe so much in educational empowerment, build schools overseas, and currently I support an elementary school. Most of my my professional career has been here in Pennsylvania, where I've worked variously at the Guthrie Clinic and right here Jefferson area, not too far from here. So a couple of years ago, I saw that people were really suffering and the COVID had devastated lives. And I saw how COVID really was being mismanaged. And there comes a time in our lives when silence is betrayal, and that time came for me a couple of years ago. And I decided to run to be a governor for our children.
Gotcha. So I want to jump back to the COVID issue in a few minutes.
Right.
Because I want to ask you some specific questions about that.
Sure.
As it relates to politics too.
Sure.
So, quick question. Why would a successful heart surgeon who's done so well get into messy politics? Because of the way it is today, it's unbelievable. It's like a blood sport.
Well, Pennsylvania is sick, and it needs a doctor. It's so sick it needs a heart surgeon. And every pillar of government, we're not functioning at the level where we should function. I'm a guy who believes very much in excellence in human service. And when I turn around and I look at our educational system and many other aspects of our government, we're not performing at the level at which we should. And I think people are tired and they deserve better. Now, politics is dirty, yes, but you have to think about it. I've always said there's two types of thieves. There's the common thief and there's the political thief.
Right.
The common thief may steal your wallet and your purse. The politician in dirty politics will steal your career, steals your future, steals your health care, and steals your education. But if we continue to allow that to happen, we're not doing well for our children. And I want to lead the charge to change that for our children.
Gotcha. Very interesting answer. So we're sitting here in southeastern Pennsylvania, right outside of Philadelphia. Philadelphia, along with a lot of urban American cities in this country, are seeing an epic wave of crime, an epic wave of murder.
Right.
Almost 95% of it landing on the black community. We're burying our kids at a record pace. We're burying women and children now at a record pace. What can you do to help this epidemic?
It's so disheartening to me to witness the death and the despair that is so common in communities, and especially communities of color and among the poor in our state and across the nation. But in the final analysis, we must realize that we've been living with crime for way too long. Even though it's accelerated and it's been exacerbated probably by COVID and many other factors, to be able to address crime, we must begin to look at the root causes of crime. And if you go to those poor communities, education or educational determination is something that is starkly absent. Also, there's despair. I call so many of these crimes that occur in the communities, I refer to them as crimes of despair. And so when you acknowledge some of these social determinants, I think it behooves on leadership to focus on addressing those determinants, because it's the only way we'll ultimately control crime and have sustainable solutions to the problems that affect those communities. What I will do as governor is immediately establish citizen councils in all those zip codes that have been suffering for too long under crime and excessive crime, murders, and death. Because what happens to one of us happens to all of us. And also, we will start to address many of the root causes of crimes in those communities. I want educational empowerment to be a priority under my administration. And how do we go about doing that? We will have to look at children and what's in their best interest. And maybe so many of those kids don't have to go through the classical pathway of high school to college. We will establish community colleges. We will establish vocational schools. And I intend to have a vocational school at least within an hour of each county. When you do that, you start to create educational empowerment and give a focus to those children. Also, we have to look at other social determinants within those communities, like housing issues, insecurities, like mental illness, for example, which I think is so prevalent and has been overlooked over the years. When you begin to focus on some of those key elements, then you're on the right road, I believe, in addressing crime. Because as I stated, a crime that occurs in South Philly is just as important, not just to the residents in that community, but to all of us across the state.
Right, absolutely. So what is your position on police and policing?
Yeah. Well, I'm not a proponent of defunding the police, because I've been a beneficiary in my life of having law enforcement come to my rescue, as many of us. I just believe that we need to come to a point where we create a better understanding between law enforcement and individuals within the community. And their presence should bring value to the community and not create the level of static that we've witnessed across the state. And I think, too, that our police force, our law enforcement in general, need to be educated as to understanding some of the determinants of social determinants of crime. And as I mentioned earlier, one of them being mental illness. And the vast majority of people who commit crimes have a certain degree, and it's a spectrum of it, of mental illness. I think if you create that forum of understanding between law enforcement and the community, we'll be in a better position, because the law enforcement is an important stakeholder in addressing crime, and so is the community. Another thing, too, I would like to engage religious leaders within our communities in addressing crime, because that in itself brings a cohesive force within the community that more than likely will lead to a very sustainable solution to these problems around crime in the communities.
So there are certain citizens, again, we're in southeastern Pennsylvania right here, right outside of Philadelphia in Bucks County. Specifically in the city of Philadelphia, there are a lot of citizens calling for the mayor to declare the city of Philadelphia a state of emergency, to declare a state of emergency. Mm-hmm. There are also politicians on both sides who say that Philadelphia should declare a state of emergency, along with other urban major cities like Chicago, Baltimore, New York, etc. Mm-hmm. How do you feel about the argument of declaring a state of emergency in cities like Philadelphia?
Well, rhetoric to me, without any meaningful strategy or action, it's really self-serving. And as I stated, the problem we've had with crime is not something new. It's been exacerbated by many other factors, one of which is COVID, of course. But I think to be able to address this problem, we must really truly focus on the root causes of it. And without that, all solutions that we embrace will be just transitory and will not, in the long run, really positively affect the community. Many of these communities are economically challenged. They have healthcare challenges, and I mentioned mental illness for one. They have educational challenges. And I think that if you begin to address these pivotal pillars of life, that's the best approach I would take. I'm a scientist and a physician. I don't really believe in addressing a serious disease with Band-Aid. If it requires radical surgery to be able to attain a sustainable solution, well, that's the option that I would pursue. And what I would do then, as governor, is that I will convene a high-performance team, just like in heart surgery, to address the problem and looking at it from various perspectives, because in the final analysis, the solutions that we attain will have to be sustainable.
Okay. So you've mentioned COVID a few times. Explain to me what you think has gone wrong with our response in America to COVID, or how politics has led COVID to a place where maybe some say it shouldn't have gone, or where could it have gone if politics wasn't in the way. In other words, one of the things, I was watching 60 Minutes last week or 2 weeks ago, and an interviewer asked, if COVID didn't come during an election year, would we have handled it differently?
Yeah. So the COVID virus, the coronavirus, is a virus that's familiar to scientists and physicians. This strain is a new strain. And I believe COVID was mismanaged on several levels. The leadership failed us in COVID because I've referred to it as leadership by fear. And it created a significant amount of hysteria that was unnecessary within communities across the vast swaths, not just of this state, across the nation. And also, when you confront it with a major scourge, like a viral scourge, like COVID, I think you need to start thinking about what are the interventional options. And unfortunately for all of us, it's been vaccine, at least for our leadership. But then when you come back and you look at who succumbed most to COVID, and still unfortunately succumb to COVID, they are the poor. They're the folks in the inner city. They're the minorities. They're the blacks. There's the Hispanics. They're those who are struggling economically that have. And so therein lies a spectrum that tells you what the risk factors are, or who's in a higher risk category. And then you start asking, what are the risk factors and why do these individuals, or certain segments of the population, are more at risk for COVID? Well, we know that people who have COPD, for example, have severe COVID or are at risk for dying from COVID. The people who have severe cardiovascular disease and many other serious medical conditions. And so as a leader, what I would have done is that when all this data began to emerge a few months after COVID arrived our shores, I would have started to look at the risk factors and risk factor mitigation policies. What can we do to reduce the risks? We have a window of opportunity to reduce the risks of people dying from COVID. Stop smoking, nutritional interventions. We know that people in the inner city generally have poor health, and that's a known in medicine. They don't have access to better choices of nutritional choices in the supermarket. They don't have access to better healthcare interventions. And if you start to address these risk factors from this perspective, I think you will do better. And so it's a broad spectrum of options that you need to attack a viral scourge. And the focus should not only be on vaccinations, and as we've seen, we've had 2 years, we've missed a window of opportunity, and it's not made significant impact. And then other policies like mask policies and mask mandates and shutdowns, we're now realizing that those really didn't help COVID.
Right.
The human body is like the United States. What protects the United States? It's the Army, it's the Marines, it's the Air Force, it's the National Guard. It's an arsenal of nuclear weapons. That's what protects us. Yeah. And so the human body, too, has antibodies. And we need to rev up those antibodies and make them stronger. And you can do that with nutrition and other interventions.
Gotcha. Last question here that we have came from someone here in the room tonight.
And we're just going to bring it back, Skip. Okay?
Last question.
Okay.
What would be the first thing you would do on day one, and why should Pennsylvania vote for a black Republican?
The first thing I will do is bring the different factions in our state together. We are too divided, we're too polarized. No agenda will have meaning if we're not together. I'm not saying we need to be uniform. I believe that it's more important for us to be united than being uniform. And only then can we start crafting an agenda moving forward. And yes, I'm an African American who's running on a Republican ticket. I embrace Republican values of hard work, family. I embrace Republican values of being pro-life and supporting our Constitution, which includes the Second Amendment. I believe in hard work. I believe in educational determinism. And I think these are values that all of us really should embrace because they're American values. And my motivation is human service, and it doesn't matter what your partisan politics are.
Great, great. Dr. Zama, thank you for your time.
Yeah, very nice
Thank
to
you
see
for the
you.
interview.
Yeah, appreciate it.